Hello everyone, welcome to my YouTube channel Logic Medico. Today's interesting topic is clinical examination of the larynx by a procedure called indirect laryngoscopy. So what is this indirect laryngoscopy? It is a visualization of the vocal cords or the glottis, including the upper tracheal rings, but mainly we see the larynx. Also a part of the pharynx, that is behind the larynx. It's called laryngopharynx or hypopharynx. When do we do this procedure? If at all the patient has got an unknown reason, unexplained reason of dysphonia or hoarseness of voice, any foreign body sensation in the throat, or even in difficulty in swallowing, it's called dysphagia. All these patients are fit into this examination of the interior of the larynx by a procedure called indirect laryngoscopy. This procedure is best done in a brightly lit room. So all the lights should be on, and in fact the daylight coming through the mirror is the best, through the windows, and we can use the headlight or a bull's eye lamp with a mirror. I will teach you that subsequently. The direct light which is traveling parallel is much better for the vision. Warming the indirect laryngoscopic mirror is utmost important over an alcohol lamp or with a warm water. This is to prevent the fogging of the mirror. I will tell you that mirror now. I will show you that. The patient should be in sitting position, upright with a straight back. This is important. They should be leaning slightly towards the doctor, with the chin pointing slightly upwards, as though in a sniffing position, like akshi, like that when you lift our chin, like that. So sit to the patient's side, that is exactly opposite to the patient, and be slightly higher level than the patient. Apply a local anesthetic to the patient's pharynx, that is a oropharynx, and ask the patient to gargle and spit it out. Test the temperature of the mirror, that is indirect laryngoscopic mirror, before starting the procedure, because if it is dangerously hot, you may cause burns inside the oral cavity of the or the pharynx of the patient. So the prerequisite is, this is the mirror I was talking of, the indirect laryngoscopic mirror or the laryngeal mirror, also called as dental mirror, available in various sizes. Size 4 or 5 is most commonly used. Adequate lighting of the room, and also a strong headlight. We can use this headlight. Okay, if this headlight is not available, from decades together we are using this bull's eye lamp. It's a high voltage lamp. It's kept behind the patient's head. Okay, this bull's eye lamp, when we on it, it's a high voltage, as I already told you. This will be behind the patient's head, this stand and the lamp. We just have to on the switch. On the switch, the lamp will throw the light. Okay, we'll wear this headgear. Okay, this headgear, and this mirror, through this mirror, this light will be reflected back onto the patient's throat. So this is called as a head mirror. We'll wear this to our head. This mirror is a concave mirror. It will focus the ray of light. This is an aperture through which the doctor sees through the mirror into the patient's throat. And gauze sponges to hold on to the patient's tongue. We want the gauze, cotton gauze. Local anesthetic spray to spray onto the patient's pharynx in order to prevent gag reflex. The patient will have like this vomiting sensation whenever you put a mirror inside the throat. So to avoid as far as possible, we are using this local anesthetic spray. Protective eyewear for the doctor, so that the patient doesn't spit onto anything. We are wearing mask also. Okay, as usual, even before COVID-19 we are using the mask and protective eyewear to prevent the spillage onto the face of the doctor. So this is how the procedure is done. You can see the bull's eye lamp here. We can see the headgear in the doctor, and through the mirror the doctor is focusing the light. Okay, here is holding on to the patient's tongue with the help of the gauze, and this indirect laryngoscopic mirror, which is pre-warmed, is now focused downwards. Okay, because superiorly palate will be there. It's focusing downwards. Through the mirror the light is reflected onto the back of the throat of the patient, and through the mirror the doctor is able to visualize the interior of the larynx. So let's see what is the procedure. We should ask the patient to sit straight and relax, and they have to stick out his or her tongue. Cover the tongue with the cotton gauze. Please Pull it with the thumb. You can see the doctor doing it here, pulling through the thumb and the middle finger of the non-dominant hand. Usually most of the doctors right-handed, so non-dominant hand is left hand. We should use the index finger to lift open the upper jaw or to lift open the upper lip. Otherwise, it will block the view. Okay. With the patient's breathing in and out, this mirror is directed. The indirect laryngoscopic mirror is directed into the mouth towards the back of the throat, making sure that the mirror is facing downwards. Okay, because we have to see down, right? When at the posterior part of the throat, you have to press the mirror slightly upwards against the uvula and soft palate. This mirror has to be pushed upwards in order to avoid gag reflex, that is like this vomiting. Okay. We should make sure that the posterior pharyngeal wall or the tongue is not touched with the mirror, otherwise the patient will gag or try to spit something. So you have to hold on to the tongue. Slightly alter the mirror position and try various angles in order to visualize the desired structures, that is interior of the larynx. Ensure the patient's head, chin and body are in still in the correct position. So make sure the patient is breathing in and out. Take note of the vocal cord while at rest. Then ask the patient. This patient we can ask them to tell one or ah, like this, tell something loudly. So when you make them tell sound loudly, the vocal cords will vibrate. You have to note the vocal cord activity, whether both the vocal cords are moving or only one side is moving. We should be able to visualize that. If the mirror gets fogged up, we have to take it out, we have to remove it out, and we have to reheat it in an alcohol lamp. Okay, and repeat from first step again. Okay, so what are the things we can see in the indirect laryngoscopic mirror? Through the mirror, we should be able to observe the posterior most part of the tongue, the tip of the epiglottis, the epiglottic bulge called the epiglottic tubercle, the false vocal cords or the vestibular folds. Okay, and inside there will be vocal cord, this white thick glistening layer vocal cord. How do you know it's vocal cord? Ask the patient to speak something loud, tell one ah something. So this will move, the white color layer, this shelf-like projection will move, whereas these things which are on the outer portion won't move. So whatever is moving is the vocal cord. Okay, and you can make out the ariepiglottic fold. These are the arytenoid cartilages. This is the epiglottis. So what is between arytenoid cartilage and epiglottis? Ariepiglottic fold. Within the ariepiglottic fold, we can make out two bulges, the corniculate and the cuneiform cartilages. Also, posterior to that or lateral to that, posterior lateral to that, there is a fossa within the pharynx. It's called the pyriform fossa. That one also we can visualize. Sometimes the tumor will be here. Okay, that is causing the dysphagia. We should note the vocal cord for any bilateral movement. If one of the vocal cord is not moving, that is paralysis. Note for mobility of both the sides when the patient is speaking loud. Note for the integrity of the vocal cord, or is there any rupture or any nodules, acne-like thing, or any polyps are there, or any tumor is there in the vocal cord which is causing the hoarseness of voice. Last but not the least, we can visualize the posterior wall of the pharynx. So these are the things which should be noted on the indirect laryngoscopy. I hope you understood the procedure. On my subsequent video, you will see direct laryngoscopy. Thank you for watching and learning from Logic Medico. Kindly subscribe to our channel and press the bell icon and like button if you gain some knowledge from this. Thank you once again.